Okay, it's 8 o'clock. Hello, everyone, and welcome. I'm Deb Dietz of SMB Digital Education. Welcome to our first of 4 webinars about COVID-19. Today, we'll be sharing details and answering your questions about pregnancy and how you can stay safe during the pandemic. If you haven't registered for our 3 additional COVID-19 webinars, on February 10th, our webinar is on bringing baby home. February 24th is on isolation and anxiety. And March 10th is on vaccines, yes or no. We'll share the link at the end of our webinar so you'll have a chance to register. We'll also have a question and answer session at the end of Pam's presentation. So please write your questions by clicking the questions tab on your Zoom bar. We're also streaming live on Facebook right now. So feel free to text your friends and let them know to watch with us on our Facebook page, Raising Confident Parents. Feel free to take notes, but we are also recording the webinar and you will receive the replay in the next day or two. But now, I'd like to introduce our pregnancy and infant care expert, Pam Jones. Hi, Pam.
Hi, Deb. How are
Great to
you?
be with you.
You too.
Hello, everyone. Please meet Pam Jones. Pam has been a registered nurse for over 25 years. She is a specialist in maternal child health and parent education. She is a certified pediatric sleep specialist and consultant and founder of the Traveling Sweet Dreams Little Ones Sleep Agency. And yes, she does travel. She will travel to your home and help you with your baby. She's also a certified parent educator. Pam and her sister, Pat Pori, are the co-authors of the best-selling book, Raising Confident Parents, Secrets from Baby Nurses and Parents About Pregnancy, Infant Care, and Achieving Sweet Dreams. And Pat and Pam just launched their online course and community, Raising Confident Parents. So again, Pam, delighted to have you today to share your knowledge about COVID-19 and pregnancy and how everyone can stay safe. So thank you so much for being with us. So for pregnant women everywhere, this should be a time of joyous anticipation and excitement for themselves and their families. But the coronavirus pandemic raises concerns. Pregnant women all over the world want to know if they and their soon to be born babies are at risk. By following doctors' advice and taking some extra precautions, which Pam will share with you tonight, you can enjoy a healthy and happy pregnancy while protecting yourself and your unborn child from the effects of COVID-19. So, let's get into what you need to know if expecting a baby during this time. Pam, take it away.
Hello, everyone. Thank you so much for joining us. We really appreciate it. This is a hard time for all of us. We realize that, but most of all, we realized as we were finishing up our online parenting class that this is an especially difficult time for pregnant women. And we really felt like there were so many questions out there that I didn't know the answer to and conflicting information. And so we wanted to put something together that could try and put everything in one spot, that we could actually understand it and, try and feel a bit more comfortable about the information that we're getting. All the information that we're using are from doctors in the CDC, but we just wanted to try and make it feel a little bit more comfortable and all of us to learn some from these webinars. So I'm so happy to be with you. US cases and deaths from COVID-19. According to the CDC, as of January 22nd, 2021, the total reported cases in the US are 24,512,000. According to the CDC, as of January 22nd, 2021, the total reported deaths in the US from COVID-19 are 408,758. 697. Those numbers are really even hard to say. The first COVID-19 vaccine was given on December 14th, 2020. According to Dr. John Tropel, MD, OB-GYN in Austin, Texas, he's also the resident expert for the Bump and Beyond. He wanted to tell us the top 10 things you should know if you're expecting. Pregnant moms are not more likely to contract COVID-19 than the general public. There is no known transmission from mother to fetus during pregnancy. However, babies are susceptible. Follow social distancing guidelines. 6 feet away, no large social gatherings. Maintain a healthy diet, exercise, and get healthy sleep. Take your vitamins, call your doctor if you're sick or you think you've been exposed to someone who may have COVID-19. Be aware of the modified hospital or clinic visitor policies. Be flexible to new approaches, telemed and/or modified prenatal schedules. Disinfect high-touch areas often, as in your keys, cell phone, remotes, doorknobs. Wash your hands and stay home as much as possible. Quarantine or isolation, what's the difference? This was really confusing, and so I think it is for a lot of people. So who should be quarantined? People who have been in close contact with someone who has COVID-19. What counts as close contact? You were within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. You provided care at home to someone who is sick with COVID-19. You had direct physical contact with the person, hugged or kissed them. You shared eating or drinking utensils. They sneezed, coughed, or somehow got respiratory droplets on you. What should you do if you've been exposed? You want to notify your doctor and stay home and monitor your health. Tell your close contacts that you've been with that they may have been exposed to COVID-19. An infected person can start to spread the virus starting 48 hours or 2 days before they have any symptoms or test positive. The CDC recommends you stay home for 14 days after your last contact with a person who has COVID-19, due to the fact that symptoms can develop 2 to 14 days after exposure. Who needs to isolate? People who have symptoms of COVID-19 and are able to recover at home. People who do not have symptoms but have tested positive for COVID-19. Isolation is used to separate people infected with COVID-19 from those who are not infected. People in isolation should stay home until it is safe for them to be around others. At home, anyone sick or infected should stay alone in a specific sick room or area and use a separate bathroom if available. Do not share personal household items such as cups, towels, or utensils. People in isolation should wear a mask whenever leaving their room or sick area. Others who must enter the room or sick area should wear a mask, even 2 masks, to keep yourself safe. While in isolation, it's important to stay in contact with your social network. Use calls and Zoom to stay connected with your family and friends. CDC recommendation for ending isolation. If you have symptoms and are tested positive for COVID-19, you need to isolate. Your isolation period ends after 10 days since symptoms first appeared, 24 hours with no fever without fever-reducing medication, and no other symptoms of COVID-19, no new symptoms, and any symptoms that you did have are improving. If you're positive, but you never had symptoms, your isolation period starts the day of your positive COVID-19 test. That day is considered day 0. Also, the first day of your symptoms is also considered day 0, and you count 10 days from there. After 10 days have passed, as long as you have no symptoms, you are safe to be around other people. You should still wash your hands before caring for your newborn. You most likely will not pass the virus to your newborn or any other close contacts after your isolation period has ended. CDC recommendation for isolation with severe illness from COVID-19. If you had a severe illness from COVID-19, you were admitted to the hospital and needed oxygen, your doctor may recommend that you stay in isolation for longer than 10 days after your symptoms first appeared, possibly up to 20 days. And you may need to finish your period of isolation at home. If you have a weakened immune system, you're immunocompromised, due to a health condition or medication, you may need to stay home and isolate longer than 10 days. Talk with your healthcare provider. Do I need to get tested again before ending isolation? The answer is no. You may continue to test positive for 3 months or more without being contagious to others. You only need to be tested again if you develop new possible COVID-19 symptoms, or you've been in close contact with someone that has tested positive in the last 14 days. What is my risk of getting COVID-19? Pregnant moms are not more likely to contract COVID-19 than the general population. Your risk of getting COVID-19 depends on the chance that you will come in contact with another infected person. The risk may be higher if you live in a community where there is a lot of COVID-19 infection, or work in healthcare or another high contact setting. About 1 to 3 per 1,000 pregnant women with COVID-19 will develop a severe illness. Compared with those who aren't pregnant, COVID-19 infected pregnant women are 3 times more likely to need ICU care, are 2 to 3 times more likely to need advanced life support and a breathing tube, and have a small increased risk of dying due to COVID-19. What is my risk for severe complications if I get COVID-19? Data shows that older pregnant women, those with pre-existing health conditions, such as a body mass index, BMI higher than 35, diabetics, people with heart disease, and Black or Latino women have an especially increased risk from COVID-19. Additionally, pregnant women with COVID-19 might be at increased risk for other adverse outcomes, such as stillbirth and preterm birth, delivering the baby earlier than 37 weeks. Staying healthy during your pregnancy. Keep all of your healthcare appointments during and after your pregnancy. Visit your healthcare provider for all recommended appointments. If you're concerned about going to your appointment because of COVID-19, ask your healthcare provider what steps they are taking to separate healthy patients from those who might be sick. If you need help finding a healthcare provider, contact your nearest hospital, clinic, community health center, or health department. Talk to your healthcare provider about how to stay healthy and take care of yourself and your baby. Ask questions about the best place to deliver your baby. Delivering your baby is always safest under the care of trained healthcare professionals, especially now. Symptoms of COVID-19. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever, chills, or cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throats, congestion or runny nose, nausea, vomiting, or diarrhea. How to stay safe. Stay at least 6 feet, about 2 arm lengths from other people, whenever possible. Cover your nose or sneeze with a tissue, then throw the tissue in the trash and wash your hands. If a tissue is not available, turn away from people and cough inside your elbow. When in public, wear a mask over your nose and mouth. If you feel more comfortable, you can wear a double mask, as long as you can breathe easily. Do not touch your eyes, nose, or mouth. Clean and disinfect frequently touched objects and surfaces. Disposable face masks should not be reused. Cloth masks must be washed after each use. If you are at high risk, you can wear double masks as long as you're able to breathe easily. You could wear surgical masks are preferred due to their 3 layers of protection. Stay home when you're sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. How to reduce your risk of getting COVID-19. When going out or interacting with others outside your immediate household, wear a mask. It is especially important for pregnant women and those who live with them to protect themselves from getting COVID-19. There is no way to have zero risk of infection, so it is important to know how to be as safe as possible. In general, the more people you are around, the closer you interact with them, and the longer that interaction is, the higher your risk of getting and spreading COVID-19. Consider the level of risk when deciding whether or not to go out or interact with people who do not live with you. Even if you do go out, ensure you and the people who live with you are taking steps to protect themselves. How to help reduce the spread of COVID-19. Limited interactions with people who might have been exposed to or who might be infected with COVID-19, including people within your household as much as possible. Even in your house, wear a mask if you are not able to social distance from someone who is in high contact with others. Take steps to prevent getting COVID-19 when you do interact with others. Wear a mask, especially when you cannot keep distance from other people. Avoid others who are not wearing masks, or ask others around you to wear a mask. Stay at least 6 feet away from others outside your household. Wash your hands with soap and water for at least 20 seconds. If soap and water is not available, use a hand sanitizer with at least 60% alcohol. Avoid activities where taking these steps might be difficult. Who should get tested for COVID-19, and when is the best time to be tested? This has been a very confusing topic for a lot of people, including myself. People who have had close contact with someone with a confirmed positive COVID-19 test result. It is best to be tested 5 to 7 days after your exposure to a known positive case. Tests are more accurate also when you have symptoms. You should stay in quarantine until you get your test results to try not to spread the virus before you have your results. People who have symptoms of COVID-19, call your healthcare provider or health department within 24 hours of your symptoms starting. Ask them when and where you can be tested. If you have have emergency symptoms, as in difficulty breathing, persistent pain or pressure in your chest, new confusion, inability to stay awake, or bluish lips or face, call 911 and advise them you are calling for yourself or someone who has or may have COVID-19. Symptoms can appear 2 to 14 days after exposure to the virus. Follow all COVID-19 safety precautions to avoid spreading the virus. Protect your baby. Get the recommended vaccines. Getting the recommended vaccines during pregnancy. Get vaccinated against influenza, the flu. Others living in your household should also get vaccinated to protect themselves and you. Get the whooping cough Tdap vaccine during pregnancy to protect your baby against whooping cough, which can have similar symptoms to COVID-19. Whooping cough can be very dangerous and even fatal to your baby. Anyone who will be in contact with your baby needs to get the Tdap vaccine at least 2 weeks before possible contact. They're giving pregnant women, the vaccine now about 37 to 38 weeks. That's changed over the years because they're hoping that the antibodies from the vaccine will actually get to the baby and help protect the baby more after they're born against whooping cough. Keep at least a 30-day supply of prescription and non-prescription medications. Talk to a healthcare provider about getting an extra supply, for example, more than 30 days, of prescription medications if possible, to reduce your trips to the pharmacy. Call your healthcare provider if you have any concern about your pregnancy, or if you get sick and think that you may have COVID-19. Do not delay getting emergency care because of COVID-19. If you need emergency help, call 911 right away. Tell them that you are pregnant and are having an emergency. If someone else is driving, call while you are on your way. If you need to drive yourself to the emergency department, call before you start driving. If you don't think that you can drive, call 911 and have an ambulance come get you. Mom support person while in labor and visitors after delivery. This has been a big question. At the beginning, they weren't letting support people in the hospital with moms during labor and delivery. That was really stressful. It's stressful enough, and you really want your partner with you to support you and be a part of this magical time that's happening. A lot of places that I've looked at have developed some new rules, but you have to call the institution that you're going to be delivering at and ask them what their rules are. So healthcare facilities providing inpatient obstetrical care should limit visitors to pregnant people who have known or suspected COVID-19 infections. Visitors should be limited to those essential for the pregnant person's well-being and care as an emotional support person. Depending upon the extent of community transmission, institutions may consider limiting visitors to one essential support person and having that person be the same individual throughout the entire hospitalization. Use of alternative mechanisms for patient and visitor interactions, such as video call applications, can be encouraged for any additional support person. Try and have this set up before you go to the hospital, so poor grandma isn't trying to figure out Zoom when she wants to see her grandbaby. Any visitors permitted to labor and delivery should be screened for symptoms of COVID-19 and should not be allowed entry if they have a fever or any other symptoms are present. Visitors should be informed about the use of masks at all times. Visitors should be instructed to only visit the patient room, no other locations within the facility, including any newborn nursery. Caring for your newborn in the hospital if you are diagnosed with COVID-19. While much is still unknown about the risk of COVID-19 to newborns born to mothers with positive COVID-19, we do know that COVID-19 is uncommon in newborns born to mothers who had COVID-19 during their pregnancy. Some newborns have tested positive for COVID-19 shortly after birth, but it is unknown if these newborns got the virus before, during, or after birth. Most newborns who tested positive for COVID-19 had mild or no symptoms and recovered. However, there are a few reports of newborns with severe COVID-19 illness. The CDC update reflects new evidence that breast milk is not a likely source of transmission of COVID-19. The breastfed baby should remain in isolation for the duration of the mom's isolation and their own quarantine time from being exposed by close contact with someone with COVID-19, as in their mom. Caring for your newborn in the hospital if you're diagnosed with COVID-19 continued. Current evidence suggests that the risk of a newborn getting COVID-19 from their mother is low, especially when the mother takes steps such as wearing a mask and washing her hands to prevent spread before and during care of the newborn. Decide if your newborn is rooming in with you in the hospital. Discuss with your healthcare provider the risks and benefits of having your newborn stay in the same room with you. Having your newborn stay in the room with you has the benefit of facilitating breastfeeding and mother-newborn bonding. Start this conversation before the baby is born, if possible. Depending on how you're feeling, though, your decision may change. If you're in isolation with COVID-19 and sharing a room with your newborn, wear a mask when you are within 6 feet of your newborn. Take all COVID-19 precautions if your newborn is rooming in with you in the hospital. Breastfeeding and COVID-19. You may find it harder to start or continue breastfeeding if you're not sharing a room with your newborn in the hospital. Here are some helpful tips. Frequent hand expression or pumping will help you establish and build your milk supply if you are separated from your newborn in the hospital. Pump or feed your baby every 2 to 3 hours, at least 8 to 12 times in 24 hours, including at night, especially in the first few days. This helps the breast to produce milk and prevents blocked milk ducts and breast infections. If you are unable to start producing milk in the hospital after birth, or you have to temporarily stop breastfeeding during your COVID-19 illness because you do not feel well enough, get help from a lactation support provider. If you have COVID-19 and choose to express breast milk, use your own breast pump, not one shared with anyone else, if possible. Wear a mask during expression. Wash your hands with soap and water for at least 20 seconds before touching any pump or bottle parts and before expressing breast milk. Follow recommendations for proper pump cleaning after each use. Clean all parts of the pump that come into contact with your breast milk. Consider having a healthy caregiver who does not have COVID-19, is not at increased risk for severe illness from COVID-19, and is not living in the same home as you. Feed the baby your expressed breast milk. If the caregiver is living in the same home or has been in close contact with you, they might have been exposed. Any caregiver feeding the baby should wear a mask when caring for the baby for the entire time you are in isolation and during their own quarantine period after you complete isolation. Keeping your baby safe and healthy. Do not put a face shield or mask on your baby. Children younger than 2 should not wear masks. A face shield could increase the risk of sudden infant death syndrome, SIDS, or accidental suffocation and strangulation. Babies move around and their movement can cause the plastic face shield to block their nose and mouth or cause the strap to wrap around their neck. CDC does not recommend the use of face shields as a substitute for masks. It's up to you. No matter what you decide, it is important that you continue to follow the COVID-19 infection prevention steps. By wearing a mask, washing your hands frequently, maintaining physical distancing of at least 6 feet, and avoiding large gatherings. Thank you. I'd like to have a special thank you to Pat Pori, who is my business partner and also my sister and partner in crime sometimes. She is a licensed professional counselor. She is a certified postpartum doula and best-selling author of Raising Confident Parents and co-creator of our class online course, Raising Confident Parents. Also, thank you to the High Risk Pregnancy Group, Society of Maternal Fetal Medicine, the CDC for up-to-date recommendations, thank you to Dr. Rachel Newman, MD, Society of Maternal Fetal Medicine, resident expert with Oath Care. Oath is onboarding for motherhood. Oath builds out a complete support community for you, bringing medical providers, like-minded peers, and a trusted facilitator together in an intimate chat group. Sign up on the wait list and get your first month free with the code Don't Mom Alone. Also, thank you to Dr. John Tropel, MD, OB-GYN in Austin, Texas, resident expert for Bump Club and beyond. BCB is the premier parenting resource, influencer, and community that works with brands and retailers to reach and engage parents with authentic programming and content.
Great job, Pam. Thank you. Thank you so much. A lot of great information, everyone. Please you type in your questions on your Zoom bar below. We have some that we've already received, and we'll be getting into those here in just a minute. But I wanted to just provide some contact information to everyone. If you would like to get a hold of Pam directly, this is her email address, so please feel free to reach out with your questions, your concerns. She is at pam@sweetdreamslittle.com. And as I said earlier, she is a traveling sleep consultant. Her sleep agency, they will come to you. She will travel to you to help you with your baby. And she's an expert, as she's certainly shown here tonight. I also invite you to please like and follow us on Facebook so you can keep in touch. Our Facebook page is Raising Confident Parents. And I also invite you to join us on your parenting journey and learn what to expect during pregnancy, how to prepare for your delivery, and what to do once the new baby comes home by joining us in our Raising Online Parents online course. Delighted to have you with us. And so I'm going to actually jump right in, Pam, with some questions that we've received. And this is one that I'm not surprised at all that we received, and it's about vaccines. And we do have our March 10th webinar is on all about vaccines, yes or no. but I think that we should probably address this, first here tonight. Should I get the vaccine, the COVID vaccine, if I'm pregnant?
Well, that is a really important question. And I'm sure that there are a lot of pregnant moms that are going through that dilemma right now of deciding yes or no. As you know, they weren't able to do a lot of studies with pregnant women with the vaccine trials. The ones that they have done, they do think it is safe to get the vaccine while you're pregnant. But what they're saying is, you have to talk to your healthcare provider. They want you to measure the risks of getting the vaccine as to how likely are you to get COVID while you're pregnant. As we've talked about, being pregnant in itself does not make you more at risk of getting COVID-19, but it does make you more at risk for severe illness. So that's what you're going to talk to your healthcare provider about, the risk and rewards of getting it or waiting. There has been some people that have gotten it and then discovered that they were pregnant, and those results, the babies were fine and the moms were fine, but there's still a lot of research that needs to be done. So as much research as I did on this question, because I knew it was important, they really just can't say for sure right now. There has to be a lot more research done, but depending on your risk factors, that's going to be your decision that you'll make with your healthcare provider.
Great. Well, thank you so much for that. Another question about risk. If I am pregnant, am I at a higher risk of getting COVID?
No. So you're not at a higher risk for getting COVID, but you are at a higher risk for severe illness if you do get COVID-19.
Okay. Thank you. Thank you. Question about breastfeeding. Can my baby get COVID from me through my breast milk?
So the research has shown now, as of now, that they do not believe that the virus is transferred through the breast milk. They've done some research and shown that the virus was placed in breast milk, and because of the pasteurization of breast milk, that the virus did not survive. So as of right now, they are saying it is not transferred through your breast milk. But again, you'll need to talk to your healthcare provider. All this information is up to date now. We know things are changing daily, and so we're going to try and keep on top of those changes. And we want you to also, because as they're learning more, they're updating more, and knowledge is power.
Exactly. And things are changing daily, right? As they get more information. Question about travel. I think a lot of people are asking about, is it safe to travel by plane right now if I'm pregnant?
Well, that is really depends on, you are more at high risk for severe illness. If you have to, absolutely have to travel, I think that your healthcare provider would tell you to take every precaution you possibly could, double mask, wipe down anything that you're going to come in contact with, your seats, everything on the plane has been cleaned, but bring wipes and clean everything again. I'm sure that they would ask you if it is not absolutely imperative that you travel right now while you're pregnant, to put off any trips until after you deliver, because you are at higher risk for severe illness.
Okay, thank you. And this is an important question. I think what we've been finding of late is pregnant ladies and their partners or partners have not been able to participate in some of the the ultrasound appointments as an example. But can I have my partner with me during my delivery?
So right now, the places that I've looked at, they are screening the partners to make sure they don't have any symptoms of COVID-19, and allowing one person, one support person with the mom. But every hospital, every medical care center is going to have different rules. So you're going to have to call where you plan to deliver, find out their exact rules, and if that's something that you want to agree to.
Thank you. Thank you. What if my partner has been exposed to COVID in the last 14 days?
Then no, they will not be allowed in the hospital. And this is something that you should talk to your doctor and tell them. But because their isolation, if they've been exposed in the last, I'm sorry, if they've been exposed in the last 14 days, then their quarantine time would not be up, because they have to quarantine for 14 days since the exposure to that positive person. So if it's only been within the last 14 days, they would still be within their quarantine time. And they would be contagious if they did end up being positive, because people are contagious, 2 to 4 days, or I'm sorry, 2 days or 48 hours before they become symptomatic, or if they don't have symptoms before they test positive. So you have still those 2 extra days that you are contagious and you may not even know it.
Okay, wow. Thank you. Thank you. Question just came in from Brittany. When should my partner get the whooping cough vaccine?
Great question. The whooping cough Tdap vaccine, I really cannot emphasize how important it is. I don't tell people to get vaccines or not get vaccines. I just really encourage you to talk to your doctor about it. Over the last few years, there has been a lot of increased cases of whooping cough, and it is and can be very, very dangerous for your baby. So that's why they started giving the moms the Tdap vaccine while they were still pregnant. We used to give it to them after they delivered, before they went home, but now they're trying even harder to protect the babies by giving it to them while they're still pregnant, to help the baby hopefully get the antibodies that will help them. So you want anyone that's going to be in contact with the baby to get the Tdap vaccine. You can get it at Walgreens, CVS, your doctor. It's not a crazy vaccine that you're not going to be able to find. You just say, I want the vaccine for whooping cough. You don't have to remember Tdap. And you want it at least 2 weeks before any contact with the baby. So remember, babies come on their own timeline. So grandma and grandpas, if you're going to, be by the babies, you want to make sure that you get it early. You can't get it too early. I mean, there is no such thing as getting it too early. So if you got it 2 months ahead of time before the baby was born, that is fine. It used to be that they had, you could get it every 10 years, and now they want you to get it every 5 years, and every pregnant woman will get a new vaccine while she's pregnant.
So would that apply to the immediate family? Everybody in the immediate family who's going to be around the baby?
Yes, anyone that can be in contact with the baby.
Okay, great.
Because you can transfer, you can be a carrier of whooping cough, not have any symptoms, and give it to the baby, and you don't even know that you're sick. If you were sick, you'd stay away, you wouldn't go and visit the baby, but you can give it to the baby without even having any symptoms yourself. And you always have that timeline where you're contagious before you get symptoms or would have any type of positive test.
Okay, wow, thank you very much. Some questions about the difference between quarantining and isolation, about the timeline. Why is the time for quarantine different than the time for isolation?
Yes, that is a really good question. And I can't tell you how much research I did to try and find an easy answer for that. Excuse me. So there are different guidelines in different counties of isolation time and quarantine time, but we are just sticking with the CDC's recommendations. So the recommendations for isolation, which is 10 days after your symptoms start, using day 0, or the date that you get tested, which is positive, using that day as day 0. And then you'll isolate for 10 days, as long as you don't have any new symptoms, no fever for 24 hours without fever medication, and 10 days, you should be fine to leave isolation. So why is quarantine 14 days? Well, from everything that I found, and honestly, there is not a very black and white answer to that. Everything's been very gray. But what I found is with quarantine, it's mainly because you've been exposed to someone. So you don't know exactly when that person you were exposed to got the virus. What day of the virus are they on? So what type of virus load did they possibly expose you to? They can be contagious 2 to 14 days. And so the CDC is recommending for quarantine, since we don't have an exact day of, like, I started my symptoms this day, I got tested this day, to count the 10 days for isolation. With the quarantine, the CDC is recommending the full 14 days of quarantine, just to be sure, because they don't have an exact day that the person you were exposed to became positive.
Okay, thank you for that. I guess one thing I know that surprised me is that you can get a positive result up to 3 months later. That is pretty amazing. But do you need to be tested before you leave isolation if you had a positive case? Do you have to be tested again or no? Because
No, you don't, which is a great question. There's been, honestly, I've been a nurse for 25 years. Babies are my specialty, but I have really learned and had to research so much because, COVID is not my specialty, and things change and they're updated, and things that you think people will tell you, they don't. And one of the reasons too, we all wanted to do this, this webinar, because even, a nurse, I was exposed, and I went to get tested 2 days later. And the doctor who seen me, the person who made the appointment, knew the day that I was exposed and made the appointment for 2 days later. And the doctor that seen me at the clinic knew the situation when I was exposed. It was 2 days later, and I was getting the test. So to me, I would think the person on the phone making the appointments, or the doctor, would say, you really should come back after 5 days, at least 5 days after your exposure, to get a more accurate test. But they didn't. No one said that to me. So, I thought, oh my God, if I have all these questions, it was really my granddaughter's school that said, oh, she had her test too early. You have to wait at least 5 days. So, which made me start looking into it, and more, all these different types of questions came up. And, the people that you expect to give you those answers, the doctor in the clinic. I had to go back and get another test after the 5 days from exposure. And thankfully I was negative, but it's just something, we're just really not getting the information that we need. And the information we're getting is conflicting and very confusing.
a moving target, right?
Mhm.
Well, thank you. Thank you. This is a question from a mom who had COVID while she was pregnant. And she says, the doctors where I live got my D-dimers, is that correct? D-dimers?
D-dimer.
Dimer tested, and they were pretty high while I was infected with COVID. I am now COVID negative, but my D-dimers are still not in the normal range, despite getting blood thinning injections. I'm currently in my 3rd trimester, And my question is, are D dimers relatively higher in pregnancy? And is this something to be worried about?
Is she by chance on the panel where we could ask her
She is
what her
not
level
actually,
was?
unless she wants to come in here to the chat or the Q&A and
We can
let us know if she's here.
certainly answer that, and then we'll just make sure that we email her back with
Sure,
more
absolutely.
information. Because what the D dimer is it is a protein that's released from a clot. When a blood clot is being broke down, there is a protein that's released, and that is what they call the D dimer. So when they test, not only for pregnancy, but they test lots of people if they are looking to see if that person has any increased clotting factors, increased clots. And so there is levels that can show if it's a negative D dimer, then there's no proteins coming up in their labs. If it's a positive D dimer, then it's more than a certain level. But during pregnancy, your D dimer does normally increase with each trimester, being the highest in your third trimester. The D dimer also increases during COVID. So from infections, from inflammation. So depending on what her levels are, yeah, so the answer is yes, your D dimer does definitely increase during pregnancy, any pregnancy, even if you have not have COVID. And it also increases if you have COVID and you're not pregnant. So definitely her doctor will keep a close eye on her. Because people that are pregnant anyway, they do have a higher risk for deep vein thrombosis, which are blood clots. And so any doctor will keep, a close eye on those numbers, close eye on her. She will definitely be watching for signs of any, back of the leg calf pain, which all pregnant women should do, any shortness of breath, difficulty breathing, pain in her chest. She, wants to make sure she'll call 911 and go to the hospital. They'll probably have her wear like stockings, which they
Like
may have her
compression?
already wearing, like compression stockings. And in the hospital, after she delivers, if she can't walk around right away, they'll have her wearing like compression stockings that blow up and decrease to keep that blood circulating. And she may have to continue on the blood thinner medication and after she delivers, just depending on what her test is, what her levels are.
Oh, that was a great question. So thank you for that great
Yeah.
answer. Also, very much appreciated. We'll make sure she gets that answer back to her. So that concludes our questions. Unless anybody's got some last minute ones they want to key in. But we're just going to wrap it up here. Again, Pam, thank you so much for your expertise and for sharing that with us. And for everyone who wants to get a hold of Pam, here's her email. Reach out to her. She's here to help and answer your questions. And she can certainly point you in the right direction. And we hope encourage you to join us on Facebook. Raising Confident Parents is our handle on Facebook. And we post regularly with course information, webinar information. And if you haven't yet registered for the 3 upcoming COVID webinars, we encourage you to do so. February 10th is Bringing Your Baby Home. So this is coming home from the hospital after you've delivered your baby. February 24th is about isolation and anxiety, which is critically important right now since we're all so sequestered. March 10th is about vaccines and yes or no. And we'll get into more detail about that. And we do have a final question that just popped up here. So let me grab it here. Is a mask required during delivery or during pushing for delivery? Do you have to wear a mask when you're pushing?
Yes, you do, which is very difficult, I'm sure. But they will have you wear a mask. Some institutions, may have you take a COVID test before you deliver, but as of right now, they are having women wear masks during labor and delivery, which I'm sure is very difficult.
Very, very hard. And hopefully their partner can be with them though while they're in delivery, so that that's a good thing. Well, thank you again, everyone, for being with us. Again, go to register for our upcoming 3 COVID webinars. Go to snbdigitaledu.com/RCP COVID. Thank you so much for being with us. Thank you, Pam, very much for your expertise. I'm Deb Dietz with SMB Digital Education. Bye for now.
Thank you so much, everyone, for joining us. I hope that this gave you some answers and clarified some of your questions. I just want to say, especially at this really difficult time, for all of us, but especially for women that are pregnant, you're not alone. We are always here for you. No matter what stage of your pregnancy, bringing your baby home, don't ever feel like you're alone. You can always call us. I love to talk babies, so I'm happy to answer any question that you have. And just use us for your support, for your village, and we're here for you. Sweet dreams, everyone.
Thanks, Pam. Thank you, everyone. Good night. Stay safe out there. Bye-bye.